But new tonight, state data reveals many communities with more people of color and poorer neighborhoods are being left behind when it comes to getting the COVID-19 vaccine.
For people in Maryvale, it feels like a repeat of this summer when people there had to wait in line for up to 10 hours just to be tested.
Now, though, a community clinic is trying to get shots to those being left behind by the state. Investigator Liliana Soto taking a closer look at what's being done to help a community that continues to struggle in this pandemic.
We're sitting right here in Maryvale. This is one of the places where COVID has hit the hardest in the entire country.
Janie Pearl Starks works at Mountain Park Health Center, a nonprofit now offering the vaccine to their patients and the general public.
When people get here, they're crying. They're in tears. They've said, I've been trying to get this vaccine for weeks. We've been waiting for this vaccine. They are sharing stories about how COVID has ravaged their family. And so they are literally in tears as they're rolling up their sleeve.
She says the Maryvale community wants the vaccine, but new data shows there's a big disparity, and a lot of those left behind are the areas with the largest communities of color.
85009 has the lowest vaccination rate of any zip code in Maricopa County. It's 90% minority.
Garrett Archer is ABC 15's data analyst. He says the common denominator here is income.
Of the top 10 zip codes that have received at least one dose, 7 are over 80,000 household income.
The richer you are, the more likely you are to get a vaccine in Maricopa County.
The problem is that the state is using the vaccine for their large-scale site, which I call a vanity site, out at State Farm, which is primarily providing vaccine to upper-income people.
Bo Humbo is the former state health director. He says the online appointment registration system is causing unequal access to the vaccine.
That could be fixed with a system in which everyone puts in their data and information, and there's a random selection of folks so that it equalizes the opportunity for people to get the vaccine, no matter what their income is, no matter how flexible their job is, no matter how good their computer is or their broadband is.
Those same access issues are what Mountain Park Health Center says they've been pointing out to the state for a long time now. So as soon as they got the vaccine, they made access to appointments available to everyone.
For family members who don't have cars, who can't do the drive-through, who can't get all there, who can't take time off work, who don't have the internet, who can't press refresh, who don't speak English, like all these barriers, for us it's just call a phone number and someone's going to pick up in your language.
It's just been kind of a history that Phoenix has of institutional racism. Is anybody actually talking about it? And I'm sure if somebody from North Phoenix or Scottsdale or Paradise Valley had to come to South Phoenix for their shots, they would be screaming.
Manuel Torres is a former sociology professor. He says his 75-year-old friend could not get the shot at State Farm.
It's almost impossible. Like my friend, he's pretty well educated, but all he has is a cell phone, and so he could not get in at all. We do not know what the plan is for the equitable distribution of the vaccine.
According to state data, only 8% of eligible Latinos has gotten the shot in comparison to 50% of white individuals.
So how concerning are these numbers when you see the disparity?
These are extremely concerning because, again, your zip code, where you work, your ethnicity should not be the determinant of whether you have a healthy outcome. Now, a pandemic is a bad thing, but you shouldn't be disproportionately affected by it because of those kinds of conditions.
Dr. Alonso Plauk is the Chief Science Officer at the Robert Wood Johnson Foundation, the nation's largest health philanthropy.
We think it is so critical to prioritize how we connect with communities of color, how we do an especially good job of providing information, trust-building activities, so we can get the vaccine distributed, get in the right arms.
He says the right arms are those of the people at a higher risk.
If you look out in Paradise Valley and Scottsdale, the life expectancy over there is about 85 years old. The life expectancy here or in South Phoenix is about 75 years old. And so there is a big difference that has to do with access to health care.
Liliana Soto, ABC 15, Arizona.
Well, we reached out to ADHS about the planning to ensure people's zip code, ethnicity, access to internet, or income won't disproportionately affect them from receiving the shot. They responded this evening by saying today is a state holiday.